The listening part of the occupational English test has 3 parts, and in each part you will hear a number of different extracts. At the beginning of the test, you will hear a beep sound. You will have time to read the questions before you hear the extracts. You will hear each extract once only. You have to complete your answers as you listen. At the end of each test, you will be given 2 minutes to check your answers. Part A. In this part of the test, you will hear 2 different extracts. In each extract, a healthcare professional is talking to his patient. For questions 1 to 24, complete the notes with the information you hear. Now, look at the notes for extract 1. Extract 1. Questions 1 to 12.
Mr. Murray, I'm Dr. Corbett.
Nice to meet you.
Yes, sir. Nice to meet you. Yeah, first time we've met.
Yes.
Yeah.
Yes.
So I understand you made an appointment for an examination.
Yes, correct.
And we're going to a complete physical examination, I understand.
Yes.
And I'm going to ask you about why you came into that. But will you mind if I take a few notes just in case?
No, that'd be fine.
In case you got lots to tell me.
Yeah.
Don't want to miss too much.
That'll be fine.
Good. Good. So you made the appointment for an exam. When's the last time you had a physical examination?
Probably 2 years ago.
2 years ago.
Yeah.
Okay. Well, tell me why you made this one.
Well, I had these chronic headaches going on that I've had for about 3 months now, and they're just not getting any better, and I want to see if there's something we can do about it.
So when you say chronic, you're referring to the fact that they've just been steady for 3 months, or they've been longer than that?
Well, it started 3 months ago, and they were like every other day or so, and now I'm having them every day. And
so you have no days when you don't have a headache?
I have a headache every day.
But at the beginning, it didn't seem to be quite as noticeable then for you, huh?
No.
Describe the headaches. Where are they, and what do they feel like?
They start at the back of my head here, and they kind of come up around my temples, I guess you call it, and into the front of my head. Sometimes they're throbbing. You know, other times they're not quite as bad.
So it's both sides of your...
Yeah.
It starts in the back and comes up the front.
Correct.
Do you have a headache all the time, or does it just come in sections?
Well, I have a headache all the time until I take something. I take Advil and Tylenol that seem to help it, and that eases it up.
Is it ever gone? Or is it always something there?
There's always something there. I always know it's there. It's just the intensity of it.
I see. Can you tell me a little bit more about what you notice? For example, when is it the worst? At night, in the morning, or does it make a difference?
Well, it doesn't make a whole lot of difference. When I don't get enough sleep, it's really bad. If I move my head in a certain way, or if I strain or stretch my head in a certain way, it seems
like what way? Can you show me that?
If I go like, you know, to the back, or even if I'm, you know, bending over. Just any exaggerated moves.
Any exaggerated move makes
it seems to make it worse. And if I don't take the Advil and the Tylenol, it seems to be worse.
Too. I see. So this 3 months ago it started. It's both sides. It's in the back, and you can't make it worse if you either extend or lean forward for too long.
Yes. Any just I call them exaggerated head movements.
What happens when you're lying down? Does that ease it or make it worse?
I think that eases it some.
It does.
You know, especially if I can get some sleep.
I see.
It seems to ease it up some.
So the act of lying down and sleeping doesn't make it worse?
No. I
Makes
wouldn't
it
say-
better, maybe?
Yes.
I see. Does it change based on if you're eating, for example?
No. You know,
Does eating make it worse or better?
no, eating doesn't seem to
So having a full stomach
exacerbate it.
doesn't
No.
seem to bother it at all?
Uh-huh.
No. How about if you're concentrating, is when you're driving or reading?
No, it doesn't make it worse, except when it's really bad, I have a hard time focusing.
Okay,
Yeah.
that's helpful.
Yeah.
Does it ever seem to be more one side than the other?
No, it always seems to come up and be just, it kind of like meets in the middle.
Meets in the middle, huh? Starts in the back, goes around, meets in the middle.
It's like a tight band.
Yep. And the part that's always there is what? In the back or all over?
I would say in the back.
In the back
Yeah.
too.
It always starts in the back. I got rear-ended in a car accident, and I can remember my neck got jerked, and I had a sore neck for a couple days, and then the headache started shortly after that.
So that accident started this thing off.
That's when it all
So
started.
you had no headache before that?
No, I had
That's helpful.
no previous headache.
So tell me about that. How fast were you? Were they going?
Well, it wasn't very fast. It was in a parking lot, and I was backing out, and somebody else was backing out the other way, and we met. And I just remember that jerk of my head
Gotcha.
and having a stiff, sore neck.
So both cars couldn't have been going more than startup?
Yeah.
Okay.
5 miles an hour or something like that.
Did you strike your head when that happened?
No.
Did you recall?
Not that I recall.
No.
I just remember it kind of being, I guess they call it whiplash.
Did you get out of the car right away?
Then I sat there for a few minutes, and then I got out of the
Did
car.
you?
It startled me.
Did you?
Yeah.
Then you said the headache started after that. How long after the actual accident did the headache start?
3 or 4 days after.
So it wasn't right away. There was a
Wasn't
little bit
right
of a
away,
warm-up. There was a kind of an interval in there where you
Yes.
felt fine. I see. Did you think that you had hurt yourself?
I didn't think I really had hurt myself. I didn't, you know, I felt startled and, you know, just kind of shaken, but I didn't feel like I was really injured.
But didn't. Okay.
I didn't go to the hospital or anything like that.
Yeah. Have you? And you said you take some things for it. What actually helps it? What do you?
Tylenol and Advil. I take, I guess it's,
How much do you take?
I take a lot. I take 16 Advils, 4 tabs, 4 times a day,
Wow.
and I take,
Self-prescribed?
yes, 2 Tylenols 4 times a day. So I'm taking
8 Tylenol and 16.
24 pills a day.
Wow. I take it you warmed up to that you weren't using
Right. I started out
I
with
see.
less and it wasn't working, so I
I
just kept
see.
adding to it, and it does give me some relief.
It's a lot of medication.
It doesn't, yeah, it seems like too much. That's one
Does
of
that-
the reasons I came to see you.
Good for you. Yeah. Does that mean it just keeps getting worse?
The headaches just kept getting worse and the severity of them, yes.
Yeah. 'Cause that's a lot of medication.
Yes.
Before you had this accident, did you use those medications much, if at all?
No, very seldom.
No, never had to take that kind of thing with
No.
any regularity?
No.
Okay. I need to know, too, what else do you experience? Anything else? Does this make your body feel different or painful or uncomfortable in any way?
It makes me feel stressed. I feel stressful with it. I can't sleep well. It's uncomfortable.
Yeah.
It's just kind of a nagging thing that's there all the time.
Does it bother your shoulders, your arms? Do you feel anything down here?
No,
Strength,
pretty good.
tingling?
No. Not really.
How about just being able to use your arms in normal motion?
Yeah,
That's not disturbed at all?
No, that's fine.
I see.
That's
I
fine.
see. Wow, so you had an accident, took a couple of days for this thing to get to you, 3 or 4 days, but then it started bothering you and persist, and now almost has this stubborn worsening. Is that what I'm...
Daily.
Daily. What kind of work do you do?
I work in a car dealership. I'm a service manager.
Oh, yeah.
Yeah.
So has this had an impact on your ability to just do your normal stuff?
Well, again, it has in that it's uncomfortable. I feel stressed because of it. I'm able to do my job. I like my job.
So you can do your work? Have you missed any days from work?
I think I missed 2 days in the beginning, but I've been at work since then. I'm able to go to work, but I make sure I have my Advil and Tylenol with me. Other than that, I'm working.
Sound like a great
okay.
employee to me. To work through this kind of thing is pretty difficult.
Well, I like what I do. You know, I work on vintage cars on the side.
I see. Yeah.
So I
Okay.
try to make it.
You know, I have a sense of what you're telling me. What's your diagnosis?
I don't know if I did something to my spinal column back there. I don't know what you guys call it, but something happened when I got hit, is what I think. A jerk did something. Other than that, I don't know what it is.
But you're fairly sure there was a couple of days in there where it wasn't obvious to you that there was anything wrong?
Other than it just being sore.
Okay.
It was sore and stiff. But the headaches didn't start, like I said, until about 3 or 4 days later.
So there was some discomfort
Yes,
right
there
away.
was.
But you would call it more soreness or stiffness
Yes.
than actual headache, like you're
Right,
Okay.
right.
Gotcha, yeah. I need to know a few more things
Okay.
about the effect of this on you. How's your sleeping? Do you sleep okay?
And I don't sleep well at all.
Why not?
The headache, the discomfort, it's hard to get to sleep. I sometimes can get to sleep and then the headache wakes me up. So my sleep patterns have been totally
So that's
disrupted.
So how much sleep are you getting at night compared to what you'd like to get?
Well, I used to sleep the night through, which was probably at least 8 hours. And I'm probably up 3 and 4 times a night now.
Wow. And how long is that? I would call it a sleep deficit. How long has that been going on?
Well, this happened 3 months ago, probably 2.5 months now. Because it wasn't as bad in the beginning, but they did just get worse.
Did you consult with anybody else, or even just toughing this out on your own?
I've just been toughing it out on my own and trying to, hoping it will go away, but it's just getting worse.
But you have been able to do your work, think, use your hands?
Yes.
Nothing disturbing that way, huh?
No.
Gotcha. Anybody else know? Did your wife, are you married?
Yes, I am.
You've been talking to your wife about this?
She certainly knows.
Extract 2. Questions 13 to 24.
So, Mr. Riley, you've been referred to me because of a problem with your knee, is that correct?
Yes, it's my right knee. It's very painful.
Okay. I've got some information here from your GP who's treated you for bursitis, but can you tell me about how this developed and what's happened so far?
Well, about 2 years ago now, my knee, this knee, swelled up and was really big. It didn't hurt, and it just looked really strange. I'd been on a week's golf holiday in Portugal, and the knee was a bit dodgy all the time I was there. Well, when I got home and the wife saw it, she sent me off to the GP straight away, who said that it was what people used to call housemaid's knee. That caused a few laughs at home, I can tell you. Then I remembered that my mum used to get that in her shoulder. It's really called bursitis, isn't it?
Yes.
But he said not to worry, to rest up a bit and wait and see if it went away. And it did in a few weeks.
Right.
So I was okay for a while. Then about a year ago, I got a new job. I used to be a painter and decorator, but I retrained as a carpet fitter. So I'm on my knees quite a bit. Goes with the job. And after a while, this must be about 6 months ago, the knee swelled up again. It looked really red this time, and I had a sort of dull pain as well that got worse.
Okay.
Also, I felt slightly shivery and feverish. The GP said I probably had an infection and gave me some antibiotics for 10 days or so. That seemed to do the trick, and I felt much better, but the knee was still a bit swollen, and it ached sometimes.
Did you try painkillers?
Oh, yeah. After a bit, the doctor suggested ibuprofen, but that always seems to give me a tummy upset, so I stuck to paracetamol. I'm still using them on and off. At work, they put me on to doing things that didn't need a lot of kneeling when I first went back, but only temporarily. And I put ice packs on my knee to bring down the swelling as often as I could, every few hours. I tried to take breaks too. Oh, and my GP suggested some exercises to protect the knee, lying down on my back and raising the leg.
Yes.
Which seems to reduce the aching. In bed, I made sure I slept with a pillow under it to keep it a bit higher up too.
Was your knee still swollen?
Yeah, it was. So then the doctor drained off some of the fluid by sticking in a needle. I remember he said he got 20 millilitres out.
Right.
After that, he suggested that I try some supports in my shoes. I couldn't really see the point of that, but apparently it's to do with your arches, which I guess does affect your knees.
Yes.
Also, he told me to make sure that I have plenty of padding on my knees when I'm at work, and I've been doing that.
Good.
He told me that I should think about losing a good few kilos as well, but I like my food, as you can see, and I haven't made any progress with that so far. But things weren't getting better, so then he started giving me cortisone injections. I've had 3 of those so far.
And what effect did they have?
They really helped. Much less swelling, and the pain's better too. But that's the problem. He now says that with those sorts of drugs, you can't have more than 3 of them in the same knee in a year. I'm up to the limit, and it keeps coming back, so really I'm hoping you'll be able to come up with something better.
Okay. Well, let's have a look, shall we? If you can...
This is the end of Part A. Now, look at Part B. Part B. In this part of the test, you will hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare environment. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You will have time to read each question before you listen. Complete the answers as you listen to the audio. Now, look at the question 25.
Hello again, Mr. Waits. We met last week, didn't we? I've been telling my colleague here about you. I've seen the results of the tests, but there are just 1 or 2 points I'd like you to clarify for me and for the benefit of Dr. Granger. You did say that this pain and discomfort has troubled you for nearly 8 months and is getting worse?
That's right, Doctor.
Can I get you to describe the character of the pain? Or in other words, tell us what it is like exactly.
It's not always a pain as such. Often it's a feeling of discomfort in my chest, like someone's pressing down on it.
What about your breathing when you get the pain?
I don't notice any difference.
Now, what would happen if you and I and Dr. Granger here went for a walk up the hill to the station?
What's that now?
I just mean, if we were to walk, what do you think would happen? Do you think you could keep up with me if I walked fast?
Oh, yes. Well, last summer I climbed up Ben Nevis in Scotland, so I've no problems there.
Question 26.
Joe, have a seat.
Finally.
Sounds like you're feeling a bit frustrated.
Dr. Miller, I've been waiting for over 2 hours. Look, when I called this morning, I explained to your receptionist that I needed this refill right away. She said you didn't do refills over the phone. I said, fine. But I explained about my busy day, and could she give me any idea as to whether you were running behind? She said she had no idea. She was completely unhelpful and rude.
So it sounds like you didn't get the straight answer you were looking for.
No, I didn't. All I wanted was a little information as to when and how long you were going to be, so I could make a decision. Should I stay or should I go? As it is, my son had to catch a cab home from his basketball game because I wasn't there to meet him.
Question 27.
Excuse me, Doctor, could I have a word about a patient?
Sure.
In room 12, we have Mrs. Tate. She's a 35-year-old G3P3 woman who came in yesterday complaining of breast tenderness, bloating and mild nausea. Her last menstrual period was 6 weeks ago. She's married with 3 children under 5 and uses contraceptive pills for birth control. On physical examination, she is afebrile with a heart rate of 90 and blood pressure of 140/80. The urine pregnancy test has resulted positive, and transvaginal ultrasound reveals a 6-week sized gestational sac with detectable fetal heartbeat. What's concerning me is that she's visibly distressed. The pregnancy was unplanned and she's anxious about the emotional and financial implications. She was on bed rest for 6 weeks during her last pregnancy and she's aware of the risks and difficulties of carrying this one to term. Would you be able to speak to her?
Question 28.
So we've talked about the various things that might have caused your father to collapse. A lot of times we investigate multiple symptoms so as to rule out any life-threatening conditions.
So it could take some time to get to the bottom of the problem?
Possibly. In the meantime, he's quite stable now, and we're encouraged by the progress that he's making.
Well, I'm glad to hear that. But at least he's not in any great discomfort, is he?
According to the assessment at the bedside by his nurse, his pain is well controlled, and we'll try to keep his sedation at an adequate level until we're ready to begin treatment.
Question 29.
Hello, Doctor. What is glioma, and what is the exact cause of glioma?
Well, the exact cause of glioma is yet to be defined, although some hereditary disorders are known to increase the chances of developing these tumors. Examples of glioma include tuberous sclerosis and neurofibromatosis. Depending on the specific type of cells involved, gliomas are categorized into different types. Ependymoma tumor arises from the ependymal cells that are found in the brain ventricles and spinal cord. Oligodendroglioma involves the cells called oligodendrocytes that provide insulation in the form of myelin. Astrocytoma tumor involves the astrocytes, which are the cells that transport nutrients and providing structural support to neurons. Mixed gliomas are the tumors that contain a combination of cell types, such as an oligoastrocytoma, for instance.
Question 30.
Microlaparoscopic pain mapping. At times, finding the cause for pelvic pain becomes very difficult. This is especially true in the case of pelvic scar tissue, endometriosis, fibroids, and other problems. In a pain mapping procedure, the patient is given some strong medication to make them sleep. After injecting local anesthetic medicine into the navel, the physician will insert a small bubble of gas inside the belly and insert a laparoscope of very tiny diameter inside the belly to look around. Another small instrument is inserted lower down on the belly and used to touch organs inside after the patient awakens. While touching the internal organs, the patient will denote whether the patient is getting pain when touching specific organs. For instance, if the endometriosis is causing pain, it will be tender while touching the organ with the instrument. Moreover, when the patient experiences pain on the right side, it is difficult to make out whether the pain is in the ovary or the appendix. Therefore, pain mapping could help figure this out and help the physician pick the exact procedure.
This is the end of Part B. Now, look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about specific aspects of their work. For questions 31 to 42, choose the answer, A, B, or C, which best fits according to what you hear. Complete the answers as you listen to the audio. Now, look at Extract 1. Extract 1, for questions 31 to 36.
Hello, Doctor. What are the types of ankle fractures?
There are different types of ankle fractures, and treatments vary significantly based on the location and severity of the injury. When a broken ankle occurs, the injury may be to the end of the medial malleolus, called tibia, or to the lateral malleolus, called or both. There are many types of ankle fractures, and let me explain you about certain common tight ankle fractures. Lateral malleolus fractures is the ankle fracture that involves only fibula. Most of the lateral malleolus fractures can be treated without surgery if the ankle joint remains stable. A surgery is recommended in case of an unstable joint or the ligaments are damaged. However, the hint for surgical recommendation is when the fibular fracture is within 4 centimeters of the end of the bone. In such case, the fracture can be treated non-surgically if there is no injury on the inner part of the ankle. Medial malleolus fractures involves only tibia. This fracture occurs to the bone on the end of the tibia, which is called the medial malleolus. An isolated medial malleolus fracture is very rare compared with an isolated lateral malleolus fracture. Generally, a displaced medial malleolus fracture is treated with surgery. Bimalleolar ankle fractures involves both fibula and tibia that occur when there is an injury to both the inner and the outer side of the ankle, always resulting in an unstable ankle joint, and surgery is to be recommended for most of the patients with this kind of fracture. Even if the fracture heals without a perfect positioning, the ankle joint alignment will remain disturbed and could result in accelerated arthritis of the ankle. Even after a surgery, ankle cartilage can be damaged at the time of the fracture, resulting in arthritis. Therefore, a proper diagnosis and repair of these fractures is essential to avoid the chance of long-term problems. Although a bimalleolar equivalent fracture involves only fibula, there is also a tear of the ligaments on the inner side of the ankle, resulting in instability of the ankle joint. Therefore, a surgery is essential. Trimalleolar fracture involves both fibula and tibia like a bimalleolar ankle fracture. However, the bone in the back of the tibia, called the posterior malleolus, is also fractured. At times, if a large fragment of bone is fractured, a surgery is inevitable. Posterior malleolus fracture involves only tibia. This is a rare injury in isolation. Fractures of the posterior malleolus generally occur in association with bimalleolar ankle fractures. In such case, the injury is called a trimalleolar ankle fracture. Mesonerve fracture involves both fibula and tibia, which is a less common injury. However, this injury needs to be diagnosed thoroughly, as there are chances of missing this injury. In this type of fracture, the bone is injured on the inner side of the ankle, called the medial malleolus. The force of this injury passes through the large ligament that connects the two bones of the leg, called the syndesmosis. Since the damage is caused to this supporting ligament, the ankle becomes unstable, and most often a surgery is recommended.
Now look at extract 2. Questions 37 to 42. The standard methods of diagnosing and assessing attention deficit hyperactivity disorder used by mental health professionals is application of the criteria established in the Diagnostic and Statistical Manual for Mental Disorders that identifies 3 presentations of attention deficit hyperactivity disorder: combined presentation, predominantly inattentive presentation, predominantly hyperactive impulsive presentation. Functional neuroimaging, such as SPECT scanning, is considered an effective tool for researchers. Type 1. Classic attention deficit disorder. People with classic attention deficit disorder have reduced blood flow in their brain area of the prefrontal cortex, cerebellum, and basal ganglia. The basal ganglia produces dopamine. Type 2. Inattentive attention deficit disorder. People with inattentive attention deficit disorder are often described as daydreamers, space cadets, and couch potatoes. This type is more common in girls than boys and is often diagnosed later in life because people with type 2 inattentive attention disorder don't have behavioral problems. People with this disorder have reduced activity in the prefrontal cortex as well as low levels of dopamine. Type 3. Over-focused attention deficit disorder. People with over-focused attention deficit disorder have a deficiency of dopamine and serotonin. The aim of treatment is to increase both these neurotransmitters, the nervous system's chemical messengers. Type 4. temporal lobe attention deficit disorder. People with this type might see or hear things that are not there, and learning and memory problems may be present. The patients will have irregularities in their temporal lobes and less activity in the prefrontal cortex part of the brain. The aim of treatment is to soothe neuronal activity and stop nerve cells from overfiring or firing unpredictably. Type 5. Limbic Attention Deficit Disorder. People with limbic attention deficit disorder have excessive activity in the limbic section of the brain, which is where moods are controlled. They have reduced activity in the prefrontal cortex, both when relaxing or focusing on a task. Type 6. Ring of Fire Attention Deficit Disorder. People with Ring of Fire Attention Deficit Disorder have an overactive brain. There are excessive amounts of activity in the central cortex and other areas of the brain. Type 7. Anxious Attention Deficit Disorder. People with anxious attention deficit disorder have high levels of activity in the basal ganglia that aid in making dopamine. This differs from the majority of the other attention deficit disorder types, which have low activity in this part of the brain. It is possible to have more than one of these types of attention deficit disorder. For example, a common combination is overfocused, limbic, and anxious types. The